Hello, listeners, and welcome to my latest podcast. This is Kenny Singh 360, and today will be interviewing Dr. Jayant Rastogi, a renowned doctor. And the topic of discussion today will be the impact of AI on healthcare. So, Dr. Rastogi, wishing a very good evening and welcome to my podcast. First of all, I'd like to ask
Good.
you a question about what are the most significant ways where AI is transforming healthcare today?
Uh, Good evening, Mr. Ganesh. Thank you for having me on your podcast. Well, your first question, that's nice. Significant ways in AI. How AI is transforming healthcare is that it helps in enhanced diagnostic accuracy. It helps in improved patient management, personalized medicine, and stuff like increases operational efficiency. And also, it offers a predictive analytics for the population of the health. Hmm.
Thank you so much. So, moving on to the next question, Dr. Jayant. Like you did mention about diagnostic processes. So, in your opinion, how do you think that AI is going to help in the diagnostic process towards patients?
Hmm. Well, AI algorithms, they can analyze, medical images and clinical data at phenomenal speed, and their accuracy is too good. It often surpasses human capabilities. I'll give you an example. AI, it can assist radiologists in identifying anomalies in scans like ultrasound, MRI, CT, and it helps immensely by increasing early detection rates of diseases such as cancer. Hmm.
Okay. So, with this, I would like to ask you that, in your opinion, has AI in any way personalized medicine?
Oh, yeah, of course. AI facilitates, personalized medicine by analyzing a whole lot of large data sets, which include stuff like genomics, proteomics, and as well as patient history. All this information enables healthcare providers, to tailor treatments based on individual responses, and this helps us in predicting which therapies will be effective and which will be most effective for the population. Hmm.
Okay, that's very insightful, Dr. Jain. And so I'm sure you would have heard of these new terms that have come out now about chatbots and virtual assistants that we see in the finance sphere also. So do you think that they'll have any benefit if these are incorporated in AI-driven chatbots for just for medical use?
Yeah, there's only one thing which is constant in life, and that is change. And we have to change and we have to adapt, sorry. So, chatbots and virtual assistants, they provide 24/7 access to medical info. They help us in appointment scheduling, and they can help patients in symptom checking, as well as for reminder of their medications. Now, they all these enhance patients' engagement and thereby increase adherence to treatment protocols. So, yes, very important.
Thank you so much.
Hmm.
And I think, yes, you brought out it very important because, appointment scheduling is one part of it. But the most important, I think, is regarding medical reminders because patients when they are old to be able to know when they need to take their medicines. And there's some kind of an automated AI chatbot which keeps constantly reminding you that you need to take your medicine. And especially in elder patients who live alone and spend a kind of considerable time on their phone. So I'm sure this will help. So moving on, do you think with all this technology that has come, do you also think that there's some potential risk towards how we're going to integrate AI into healthcare?
Yes, yes, absolutely. There are risks with everything. So risks include over reliance on algorithms, then of course data privacy concerns, and as with everything, there can be potential biases in AI training data, leading to disparities in health and also lack of accountability, for AI-driven decisions. So this is a challenge which has to be addressed.
Thank you so much, Dr. Jain. Just to add here, I think when we're talking about potential risks of integrating AI, this is patient doctor confidentiality and even the medicines that they are supposed to take and when are they taking and what duration are taking and what are the prescriptions given is supposed to be confidential data, right?
Yes, absolutely.
So if you're going to include AI and this kind of data breaches which are very common nowadays, and data mining is and all that is happening, so there could be a possibility when say a largely AI driven hospital, there could be possibilities of leakage of data. So moving on
Yes,
to our
yes.
next question, do you think that AI can help in management of especially these kind of diseases are very chronic in nature?
Yes, I absolutely think so. AI, it can monitor data in real time. So through wearables as well as mobile apps, it can send alerts for irregularities, like we have your iWatch. So it can also provide tailored educational content and also facilitate telehealth consultations. All these, they empower patients to manage their conditions better and also to feel better. So yes. Hmm.
Okay, great. I'm sure that, we can see some progress in this department that you mentioned. So there is this concept, I'm sure you are aware, talk about predictive analytics in healthcare. And do
Yes.
you think that AI will be able to contribute in this sphere of predictive analytics on patients?
Oh, yes. AI, the beauty of AI is it can do anything what we want it to do. So basically, predictive analytics, it refers to use of data and algorithms and machine learning techniques. And we use it to identify the likelihood of future outcomes based on historical data. So AI enhances this by processing vast data sets, to make more accurate predictions. And all this predictions regarding patient outcomes. And this basically helps us to treat and manage the patients better. Yes.
Okay, so we now move on to another question that has come from some of our viewers. So they also want to know that does AI, will you think in the future will be able to influence the drug recovery process? And can you just tell us a little about what is actually recovery process?
Oh, yes. So AI, it basically accelerates drug recovery, discovery by stimulating interactions of compounds, predicting their potential efficacy as well as toxicity. So what is drug discovery processes? We in a supposing you go to a doctor and he gives you a prescription which consists of many drugs, which is medicines. So how one medicine interacts with the other, that is the base is what discovery is. So all these can significantly reduce the time and cost associated with bringing new medications to the markets. And so yes, it will help us. It will influence the drug discovery process.
Okay, thank you so much, Dr. Jain. And now we come to one of the very important question that is being asked about is that today, with the advent of so much use of social media and so many stimuluses that people are developing, and mental health care today is of most paramount importance vis-a-vis in the last couple of decades. So do you think is there any possibility where AI may be used to treat mental health care? Dr. Jain, we got you back online. I think we had a slight technical hitch where we lost you. So
Yes, yes, yes.
I hope you're there.
Yes, yes, absolutely.
Okay, so as I'm sure you would have heard, my question was regarding AI. How it can help mental health care today because of all the issues that I had mentioned. So, do you feel, in your opinion, mental health care can be given a boost using AI?
Yes, absolutely. Mental health is a very, very important topic, and the curtain of taboo is lifted away from mental health in the recent past. So, yes, AI, it assists in mental health care immensely. Through it can help in through sentiment analysis of the patients. It helps in providing virtual therapy sessions, recommending interventions, as well as in monitoring treatment adherence, as well as also you can monitor patient move through various apps. So all these will help in control monitoring the mental health of patients. Hmm.
Thank you, Doctor. So, just on the latter half of the podcast today, so we just take on two, three very important questions. So there's also talk about the ethical implications, sorry, on AI and healthcare decision making in specific. So do you think that there are bound to be some ethical implications in the future?
Oh, yes, a very, very important question. Ethical implications are very important and they are set in place in order to safeguard humans per se. So, ethical implications will include issues such as bias in algorithms, uh, any bias can affect treatment equity. There should also be transparency in AI decision making. Very, very important again. And all this, along with all this, there also has to be the importance of informed consent. And because without consent, no treatment is possible. And finally, there should be a need for accountability when AI systems make clinical recommendations. So, very very challenging scenario, but it will be addressed, I'm sure. Yes.
So there are a lot of concerns that are coming up regarding patient data security and privacy. Do you think that AI will be able to handle this, or are we have adequate systems in place to ensure what we did talk about earlier also, that how would patient data security and privacy be handled?
Yes, good question, Mr. Kanesh. You see, AI is evolving constantly, and whatever mistakes it makes, it gets improved. There is an improvement which comes up. So AI systems, they implement various measures for data security. We have stuff like encryption, secure access controls, stuff like data anonymization, and compliance with regulatory bodies like HIPAA and stuff like that. So these all this ensures patients informations ensures that the patient information is safeguarded.
Okay, I think that
Yes.
once it's incorporated, will have to be also incorporate the cyber experts and those who will handle the data as well as the hardware and the software part of it, which needs to be, adequately looked into. I'm
Yes,
sure
yes,
once it's
absolutely.
implemented in large scale hospitals, and people will pay adequate attention to this. So, but
Yes.
now moving on to the next question. Telemedicine has been around for a long time and it has been used in its traditional form. But now they are also talking about how is there a possibility we can, AI can contribute towards telemedicine, and how can it, it can be, these two can be, synchronized in a manner where they could provide the necessary advice to patients who opt for this type of diagnostic treatment.
Yes. So, telemedicine it basically picked up when COVID and lockdowns were instituted. So, basically, AI will enhance telemedicine by providing virtual triage as well as offering AI powered diagnostic tools and helps in analyzing patient data remotely. All this can overall lead to better patient experience through, I guess, better personalized interaction. So yes, this will help. AI will help in telemedicine. Yes.
I'm sure that will help our viewers a lot to decide and opt for these facilities, either it's free or paid. So we're also looking at now we've basically till now we've spoken about the technical aspects and the medical technical aspects of it, but now there's also talk of do you think there is a possibility if AI can help us improve the healthcare operations and the administrative capabilities of a hospital or a setup? Do you think that there can be any way where they can help in the operational and administrative parts also?
Yes, AI is very, very good at that, I must say. So stuff like scheduling, billing, record keeping, you know, all this AI can manage, and all this reduces costs and also improves the efficiency. And once this is in place, it enables healthcare providers to focus more on patient care rather than administrative burdens. Yes.
Okay, so I think we've covered most of the points that had been asked to us. So I'll further move down a little to next more pertinent question. Not the ones that I mentioned, the top three, but I'll just further come down. So, can you just tell us about what, in your opinion, are some emerging trends in AI and healthcare?
Emerging trends, yes, of course. Emerging trends, they include development of explainable AI for transparency, the integration of AI with IoT devices for real-time health monitoring, and advancement in stuff like natural language processing. All this, it helps to improve clinical documentation and personal and as well as patient interactions. So AI is here to stay, and it was going to, totally revolutionize healthcare in the coming decade. I'm 100% sure on that.
Okay, thank you so
Yes.
much. So, you being like a medical practitioner, a doctor, how do you personally perceive it, that how AI technology, matlab, how is the medical industry, the medical fraternity, perceiving that how AI technology is, are they against it or pro it? What is the kind of response in the medical community?
That's a really nice one. So to give you my personal example, I'm not old school, but neither am I new school. So I'm somewhere in the middle. And like I said, the only thing constant is life is change. So my takeaway on AI is that you use it, otherwise you will be left behind. And AI is here to stay. It is here to change our lives. So we have to learn to use it, and we have to use it responsibly. That is very, very important. And I think if certain checks are in place, it should be a boon for the society.
Okay.
Yes.
Thank you so much, Jent. And now we're coming to the last question of our podcast today because we're running out of time. And I like to keep these podcasts a little short and crisp because to gain the attention of our viewers. And today, in the world of reels and short films, I tend to keep my podcast just up to about 15 minutes. So, coming to the last question, what do you think is the future outlook for AI in healthcare specifically?
Well, the future is bright. The AI healthcare looks promising with the expected, advancements in patient-centered care. It will help in boosting operational efficiencies as well as enhance the capabilities and diagnosis as well as treatments. But yes, as we discussed, ethical and regulatory aspects will be have to be carefully scrutinized, and before AI can be thoroughly implemented. So it will eventually happen. Yes.
Okay, so that wraps up my podcast, Dr. Jain. Thank you so much for taking out your precious time and getting to us on a call all the way from Nainital. And wishing you all the very best. And I'm sure your valuable inputs that you have given to me for my podcast will enable the viewers to really understand the context of AI in healthcare and how it's going to boost them in the years ahead. Thank you very much, Dr. Jain, for coming on my show.
Thank you so much, Mr. Ganesh. It was been a pleasure, and it will always be a pleasure to interact with you.
I look forward to speaking to you again sometime in any medical related healthcare. I believe you're also looking into a lot of sports related injuries, and that is your forte. So I think next time we can call you on our podcast to for us to for you to enlighten our viewers on the aspects of sports related injuries.
Yes, yes, yes. Anytime, anytime.
Okay, thank you, Dr. Jayant. Good evening and have a great evening.
Thank you, sir. Thank you.